First of all, Assalamualaikum and a very good morning to our lovely lecturer, Madam Azurai, and our fellow classmates. Our topic for today is Kaizen costings. But first, let me introduce myself and my fellow groupmate. My name is Arif. Then we have Ayuni. Then we have Cairo. The next slide, please. First, I would like to introduce what Kaizen costing is. Kaizen costing is a cost-cutting approach for controlling costs. Continuous improvement costing is another name for it. The strategy is designed to reduce costs below industry standards while maintaining quality, staffing, and safety. The concept is comparable to target cost, which involves managers attempting to achieve a goal with less resources. Target costing, on the other hand, is utilized during the design stage, whereas Kaizen costing is employed at the production stage. What's more, Kaizen costing necessitates a high level of staff participation, whereas target costing simply demands the participation of a few designers. And for the next part, I will pass it to Cairo to explain about the purpose of Kaizen costing.
Thank you, Arif. My name is Cheryl. So I will be discussing on the purposes of Kaizen costing. So the main purpose of Kaizen costing is cost reduction. So on any cost that is obtained from non-value added activities is aimed to be eliminated through this Kaizen costing system. Aside from that, Kaizen costing also focuses on increasing employee satisfaction. What is meant by this is that usually employees are the ones who are involved in production processes, and they are the ones who identify all these non-value added activities. Therefore, by applying this Kaizen system costing, they can reduce any redundancy in their work. Simultaneously, by reducing these redundancies, they are able to improve their working commitment with the company. Aside from that, Kaizen costing implementation can also increase the company's productivity. Therefore, it can also create a healthy competitive environment against other companies in the same industries. Moving on, we will be discussing further on the implementation and comparison of Kaizen costing across three industries, which is automotive, industrial, and healthcare. So for automotive, it will be further explained by Ayuni.
Thank you, Chero. So the first industry that has implemented the Kaizen costing is automotive. So based on the article that I have chosen in the automotive sector, which is about a company that is famous for producing motor and car batteries. They have faced the same problem in the last 2 years and decided to use the Kaizen costing through the PDCA cycle, which is the plan, do, check, and action. The main problem they face is the high number of scrap plates in the production, which contributed by the process of pasting, where they have 2.45% of scrap plates. The main issue occur in the process of pasting is because the plates that is coming from the roll feeder falls into the grid 2 pieces simultaneously. It is supposed to be piece by piece and into the hopper, and therefore it creates a jam, and which causes the scrap plates, the plates to defect and should be scrapped. So to resolve this, the company had decided to use the YY analysis as an analytical tool and involve the multidisciplinary team to brainstorm the causes so that the cost to incur in order to resolve this could be at the lowest. The company, after the company implement the Kaizen costing, the number of scrap plate is lowered than targeted, which is 1.52%. They also add up a periodic check in the pasting process and did not need any expenses as they only redesigned the process and use available spare parts. As a whole, it had increased the productivity as no more plates jamming into the hopper. Next sector will be discussed by Chero.
Thank you, Ayuni. So for industrial sector, the article that I used to refer is a study conducted on JSC Kental Transformer Plant. It is a plant that produces electrical components and supplies transformers, and it is based in Turkey. So how they implemented Kaizen costing in this plant or in this company is they used the Poka Yoke system. The Poka Yoke system is where it ensures that all the right conditions of the product is fulfilled before moving on to the next step, which means that at every level of production, there is constant checking or evaluation being done so that any defective products that is detected at each level can be eliminated immediately instead of waiting for the product to be fully finished, and only then the elimination process takes place. So the company had faced higher costs because of high level of wastage. Now, what are the wastage? It is wastage of products, whereby there are defective and non-defective products. Defective products are the one that I've mentioned before, whereby they were able to detect a large sum of products once the product has been fully produced. And in terms of non-defective products, it basically means that there is a higher level of inventory in the company than required. Aside from that, there is also wastage in non-value added activities such as process of purchasing, holding, transporting raw materials, and during production. So upon implementing Kaizen costing, a survey was conducted among the plant managers, and it has been found that the company was able to save costs of about 15% in raw materials and materials expenses. So from there onwards, the company have established a standardized purchasing policy within the company and also with the suppliers. Moving forward, the healthcare sector will be further discussed by Arif.
Thank you, Carol. For the healthcare sector in this particular study is about the healthcare waste management in regional referral hospitals in Tanzania. The implementation process that we use on this particular study is the Kaizen method through the 5S, which is sort, set in order, clean, standardize, and sustain. In this study, it was found that most of the hospitals in Tanzania did not perform the necessary processes of disposing medical waste that can lead to other problems. In fact, 10 to 15% of the medical waste is hazardous, which can lead to more infectious illness and increased costs. This is because of poor strategies and policies conducted by the health ministers of Tanzania, followed by poor understanding by the healthcare workers and insufficient funds to provide better equipment to cater the modern requirements of proper medical waste. As a result, after the implementation of the 5S Kaizen approach, it has improved significantly with proper training, annual consultation visits, and external hospital performance assessment. In fact, it has received good feedback and improvements for medical waste management. Benefits that were recognized are better working environment for the workers, and of course, training provided for the workers. Next is safer for both workers and consumers. Other than that, it has increased efficiency and helped this particular sector to stay within the budget. And lastly, it has improved moral for both workers and consumers. And then for the next part of the presentation, I will pass to Ayuni to discuss further on the comparison.
Thank you, Arif. So in the automotive sector, the difference that I have discovered is the working routine. In manufacturing sector, they do routine operations specified by the company, while the healthcare sector employees are more educated and self-sufficient in arranging their daily tasks. Therefore, the manufacturing workers can implement Kaizen costing easier as they operate with a new perspective. Next differences will be discussed by Chero.
Thank you, Ayuni. So as for the industrial sector, Kaizen costing is focused more on labor work because of the various production processes, unlike automotive, whereby Kaizen costing may be focused on the equipments or parts of the automotive. How about the differences in healthcare, Arif?
Well, in the differences in healthcare is in goal clarity, which differs as compared to the manufacturing sector. In the healthcare sector, it relates to the lack of a common language because of patient pathways across professions. Because as we know, as we are human beings, we tend to get different types of illness and type of diseases, and that requires special skills and knowledge that is more difficult than common manufacturing. Other than that, time management is critical as healthcare workers tend to put patients' lives as their main priority. But it does not mean it is a waste of time for the healthcare sector to spend more time to improve their quality of service. In fact, it will give them a better feedback to both their consumers and their workers. Then that's all the differences for the healthcare sector. Then we'll pass to Cairo for the similarities. Thank you.
Thank you, Arif. So after observing these three industries, automotive, industrial, and healthcare, we have noticed that the similarities is that Kaizen costing is involving all level of employees. There is involvement of multidisciplinary team, which means that employees from different backgrounds or different expertise are also have general knowledge in Kaizen costing. And we have also noticed that with the implementation of Kaizen costing, there is a continuous small improvements made in the company. Therefore, it had also increased both employees and customer satisfaction.
As conclusion, Kaizen costing is a Japanese philosophy that has been implemented by big companies worldwide, such as Nike, an American company, Nestle, a Switzerland company, due to its advantages and benefits, such as refining daily operations, assuring employee involvement, waste removal, and also Kaizen costing helps in reduces costs. Therefore, we agree that Kaizen costing should be implemented by other companies too. Thank you.